All right, hello and welcome everyone to our second round of public webinars for 2019. My name is Brenna Rabel and I oversee education and outreach on the Measures Management System contract, which is funded by the Centers for Medicare and Medicaid Services, or CMS. Today's presentation, Patient-Centered Quality Measurement, what it is and how to get involved, is intended to provide an overview of clinical quality measures and how patients and other stakeholders are considered and involved in the process of developing them. So we'll talk about the various phases of the measure lifecycle and describe the ways in which stakeholder feedback is collected and used throughout each phase. I'm joined on the call today by Kim Rawlings, who's the CMS lead for this contract, and also Dr. Nicole Brennan, who serves as the Senior Project Director for this work. And you're going to hear from each of them later on in this presentation. But before we dive into today's topic, I want to take a moment to just talk a little bit more about this public webinar series. These webinars are part of an ongoing effort to engage measure developers, consumers, and other stakeholders in quality measurement topics, an effort that also includes a series of newsletters and bulletins, monthly information sessions, and routine updates to the Measures Management System website. So these webinars typically occur over the summer and focus on broad topics that are related to quality development, intended to help introduce those who are new to measure development to key concepts and to orient stakeholders such as patients and frontline clinicians to the work that's being done around quality measures. A couple more things before we jump into this presentation. First, today's session is being recorded for note-taking purposes. Second, this presentation is offered in a broadcast-only format, which means you will not be able to unmute yourself to ask questions. If you do have a question at any time throughout the presentation, please type your question using the Q&A feature or the chat box in WebEx. We'll queue your questions in the order they're received, and we'll do our best to get to all of them during the Q&A period later in the call. The presentation slides for this session are posted to the MMS website for your reference. We will also post a recording of today's presentation on the CMS YouTube page in a week or two. And finally, please take note of the survey questions in WebEx. This poll will remain open throughout the presentation. Please take a few moments to fill that out before we finish up today. Your feedback is important to us as we plan future webinars. And here's the agenda for today's call. We're going to start with an introduction to CMS and its quality goals. Then we're going to talk a little bit about what quality measures are and how they're used in the Meaningful Measures framework. And then we're going to talk in detail about how stakeholder involvement is important throughout the measure lifecycle. And with that, I'm going to turn the presentation over to Kim Rawlings to talk about CMS quality measures and the Meaningful Measures framework.
Thank you, Brenna. So my name is Kimberly Rawlings, and I'm the lead for the Measures Manager at CMS, as well as a member of the team working on Meaningful Measures. And so I'm excited today to give you a very quick overview of quality measures at CMS and the Meaningful Measures initiative, just to help set the stage for our discussion today on patient-centered quality measures. So our main goal at CMS is to really improve the healthcare outcomes of patients by making sure that patients are achieving good results and that the care that they receive is really aligned with the most up-to-date and evidence-based guidelines available. And so clinical quality measures, or CQMs, or simply measures, are tools that help to quantify healthcare quality by quantifying healthcare processes, outcomes, patient perception, and organizational structure and/or system. And so let's walk through a quick example to try and help clarify the definition and different types of measures using diabetes as an example condition. So a measure related to diabetes might quantify a process. For example, the percentage of diabetic patients who receive a foot exam during their annual wellness visits. The process being measured there is the foot exam. Or a measure might track patient experience and really look at whether the patient was able to get the necessary appointment and care as quickly as they needed it. A measure could also track diabetes outcomes, and that might look at the number of hospitalizations or deaths attributable to poorly controlled blood sugar. And lastly, a different type of measure might look at the organizational structure and really look at whether a healthcare facility has the appropriate lab equipment or staff to try and process the relevant lab tests needed to take care of a patient with diabetes. So all of these are really examples that help represent the different facets of care that can be qualified with a quality measure, as well as kind of outline the different types of quality measures, being process, outcome, structure, etc. And many CMS measures are used for public reporting and payment programs, and so it's really important that all measures are tested to demonstrate the relationship to the provision of high-quality care and or related to the quality goals for health care. They must also be supported by good evidence, meaning that there must be information either in peer-reviewed literature or in clinical guidelines that really aligns with the measure's intent. And so why do we use measures to measure healthcare quality? Well, measures are associated with two main goals, and I'm going to outline here. First, measures are a tool to help guide decision-making, which will lead to improved quality of health care provided to patients. Here, what we mean by good decision is one that makes it more likely that patients and their providers will experience a good result or a good health outcome, and makes it less likely that they will experience an adverse one. And measures, they give us that data, that information to really help us look and see if change is necessary. If a clinician or a hospital or provider discovers that they're performing poorly on a given quality measure, they can choose to, reallocate resources, to make changes to their practice to try and become high-performing and improve on that quality measure. Because the measures are based on clinical guidelines, we can assume that a clinician or provider or hospital that performs well on the measure is providing high-quality care in that particular clinical area for those patients. Second, measures can be used to also empower patients, to help them make informed decisions about where to go for care through public reporting. It's important to us that patients not only make information or make decisions using cost information, but that they have quality information to balance the cost information as well. And so some quality measure results are publicly reported and can be found in places such as Physician Compare, Hospital Compare, Nursing Home Compare, etc. Those websites, this information can be used to help guide the patients or their family members or caregivers decision-making when selecting a provider for a specific condition or treatment. However, not every quality measure is used for this purpose, and CMS is still working on improving the ways that patients can use measures for this purpose. But nonetheless, it is a very important aspect of measures and their use. And so given the purpose of measures and their importance to not only patients but also providers, it makes sense that CMS selects measures based on priorities articulated through a number of various avenues. You've probably heard of the Meaningful Measures Initiative, which I'm going to describe briefly on the next slide, but there are also several other factors to consider. Most CMS quality reporting and incentive programs are born out of legislation, and oftentimes that legislation has outlined specific measure requirements that need to be taken into account when developing the measures for that program. We also receive input and feedback from patients, clinicians, advocacy organizations, specialty societies, and other stakeholders through public comment, technical expert panels, MAC work groups, etc. And we consider this feedback very valuable, and we're going to outline these opportunities later in the presentation. Another significant measure planning and prioritization input includes reports and documents such as the MedPAC or the MACPAC reports, and reports from other agencies like ARC. We also have plans for specific programs, like we have the Quality Measure Development Plan for MACRA, or environmental scans and gaps analysis are really standard in the beginning stages of measure development for any specific program. So before we go back to Brenna and delve into the importance of patient-centered measurement and how patients and others can get involved in the measure development process, I do want to and just briefly touch on meaningful measures, because the patient-provider relationship and the patients are really at the center of this initiative. So CMS launched the Meaningful Measures Initiative in October 2017 to help us achieve high-quality healthcare and meaningful outcomes for patients. The framework and various components of the initiative really help to focus everyone's efforts on the same quality areas and really lend specificity to the attributes of the measures. And involving patients in the measure development process and having patient-centered measures are really at the core of this initiative. So by using meaningful measures, we hope at CMS that the measures in our programs will embody many of the following attributes that you see on the screen. So with the added focus and specificity, we want to ensure that we are identifying quality measures and quality measurement opportunities that are patient-centered and meaningful to patients, clinicians, and providers. And by doing this, we know it will lead us to look at outcome-based, high-impact opportunities that really safeguard public health while still identifying significant opportunities for improvement. And we want to address measures and improvement activities that are value-based, and most importantly, align across programs and payers, because we believe that will decrease the administrative burden of that collection and really ultimately improve the patient-provider relationship. And like I mentioned before, we do have the input of legislation, and so we need to do all of this while keeping in mind that we need to fulfill statutory requirements for each of our programs. And so by achieving these objectives, we will guide real measurable improvements for the nation while also encouraging the use of more parsimonious measure sets and working to reduce the burden of measurement for clinicians and providers, which ultimately will lead us to improve the quality of care for our patients. This is the Meaningful Measures Framework, and as a part of this initiative, we have the framework to really help us focus in on specific quality measurement areas across our programs. And so I encourage you to study this in some detail later, but I want to just walk through it quickly with you. So hopefully you're seeing the visual in the center and hearing that theme throughout our presentation today, that the patient really is at the center of everything that we do at CMS. And they, along with the clinicians, at the center of the framework. And along with this depiction of the patient-clinician relationship, you'll see our 4 CMS strategic goals: improve CMS customer experience, support state flexibility and local leadership, support innovative approaches, and empower patients and doctors. And these goals really serve as the foundational principles of everything that we do. Around that, you'll see the 6 cross-cutting criteria. And these cross-cutting criteria serve the desired outcomes for CMS along with our partners. We believe that they are critical to improving the health outcomes of our patients and just improving the overall health care system. Then we have the 6 health care priorities for CMS, which are depicted by the 6 pictures along with the goals in the list. And those 6 priorities are further specified into 19 meaningful measure areas. And hopefully in looking at these various meaningful measure areas, you'll see how these all relate to patients, to patient experience, to patient satisfaction, to improve patient outcomes. And in particular, I want to draw your attention to the healthcare priority of strengthen person and family engagement as partners in their care in the meaningful measure areas inside of it. So under this, we have several meaningful measure areas, which includes functional outcome, patient experience, care is personalized, end-of-life care, etc. And so we really, when developing the meaningful measures framework, we really had the patient in mind and improving their care in mind as we developed this. And so with that, to talk more about patient-centered measurement, I'm going to turn it back over to Brenna.
All right, so now that we've talked about quality measures and CMS goals and priorities surrounding them, let's jump back into the topic of patient-centered quality measurement. To be considered patient-centered, measures must be, to some extent, developed for and by patients. Now, obviously, measures are typically developed by experienced measure developers who may or may not be patients themselves, but what we're talking about here is a concerted effort to gather input from patients, specifically patients with experience interacting with the healthcare system for the condition or treatment being measured, to help inform and shape the measure under development. So a big part of this is to find out what's important and meaningful to those patients and working to design a measure that takes those things into consideration. For example, thinking through measures related to chronic pain management, a measure developer might seek input from patients to understand their experiences with chronic pain and to hear from their perspective about the interactions they have with the healthcare system and where the opportunities are for improvement. What treatments or options would be the most valuable to them? What kinds of measures would be the most meaningful or usable? A measure related to alternative therapies or one that looks at opioid prescribing, for example. Patient-centered measurement should factor in these perspectives and, of course, balance them against clinical guidelines or evidence to create measures that are useful and meaningful to patients and that also promote healthcare practices that align with information available in the clinical literature. So for this reason, measure developers will also seek clinician input during development, which we will also discuss in some more detail today. I should also mention here that patient-centered quality measurement also includes measures of patient-reported outcomes or patient experience. So this relates to what Kim was talking about in the meaningful measures framework. So for these types of measures, information is gathered directly from patients about their symptoms or experiences with the healthcare system, and that direct information is what's used to determine the quality of care being delivered to patients. Obviously, the nature of these measures dictates that they are patient-centered by design, but nevertheless, the same principles apply when developing them. Patients and other stakeholders, their input should be gathered during development to ensure that these measures, when implemented, will generate information that is meaningful and important to patients. So there are a few ways that measure developers typically gather patient input and other stakeholder input. The most hands-on avenue for a patient to get involved in measure development is via a technical expert panel, or TEP. So TEP is a group of experts, and we do consider patients to be experts of their lived experiences, who are convened by a measure developer to support measure development. So measure developers who are contracted with CMS are required to post calls for TEPs on the MMS website, which is linked here. You can search opportunities to join a TEP by visiting that page and self-nominate if your experience aligns with the needs of that particular project. And as a member of a TEP, patients are invited to talk about their experiences with the healthcare system and to provide important perspectives that might balance or provide context around the perspectives of the clinicians or methodology experts that are also on those panels. Additionally, most measures undergo what is called public comment, which is a formal opportunity for members of the public to provide feedback on measures that are under development or maintenance. Measures are typically posted online for around 30 days, during which time anyone can review the measure information and submit a comment with feedback about the measure. To log a comment, there's an online ticketing system called Jira that CMS uses, and Dr. Brennan is going to talk about that a bit later in this presentation. And then finally, measures also undergo testing before they can be used in a program. And testing activities vary from measure to measure, but in many cases, measure testing might include focus groups or interviews with clinicians or patients, and also on-site testing at hospitals or clinician practices. So this presents an opportunity for both clinicians and patients to contribute meaningfully to how measures are specified. And these types of opportunities are typically advertised via the MMS newsletter that is overseen under our contract, and that's linked here. I'd also add, though, that there are other ways to get involved in measure development than just by signing up for a TEP or getting recruited to participate in testing. A great way for patients in particular to get involved in this work is to get involved with patient advocacy groups. These groups tend to be more tapped into quality measurement and other policy issues that impact patients, and often serve as a conduit between patients and CMS measure developers. And getting involved with a patient advocacy group might help you stay in the loop about opportunities to participate in measure development activities, but also upcoming webinars or information sessions, and public comment opportunities that might be relevant to you. So if you're interested in receiving announcements when opportunities like these arise, or if you'd like more information about involvement in patient advocacy organizations, feel free to email us at mmssupport@bitel.org, and we can get you signed up for the MMS newsletter or get you connected with folks that can help with the patient advocacy membership. So this graphic is a representation of the measure lifecycle. I'm going to walk through each of the phases of the measure lifecycle here to help tee up the rest of this presentation, which is going to discuss the different ways that stakeholder feedback can be used throughout the lifecycle. So the first here on the left is conceptualization. This is where the process begins, where CMS and its measure developers identify an important issue or area of need and begin researching it to better understand the problem, possible solutions, and gaps in quality measurement. The second phase is measure specification. This is the point at which that initial idea really becomes a measure. The developers flesh out the measure details, also called measure specifications, and can really start to nail down the population the measure will target, how the different parts of the measure will be defined, and how the measure will be scored or calculated. You'll notice the circulating arrows between this step and the next one, which is measure testing. This is to signify that specification and testing are iterative. So this isn't a process where the measures are specified and then tested to check a box that says, okay, we tested the measure and now it's ready. On the contrary, the testing phase is where measure developers really think about what they need to know to prove that the measure is sound and usable, and to help them identify changes that they could make to improve the measure. So during testing, measure developers come up with a list of research questions and do a series of activities to answer those questions. These activities might be qualitative, such as talking to patients, clinicians, or technical experts, or quantitative, and that would be more like collecting real data from hospitals or practices to see whether the measure results reflect the actual quality of care provided at those places. And information gathered throughout testing is then used to make the changes to the specifications to ensure that the resulting measure is scientifically sound, unlikely to result in negative unintended consequences, and then also useful and important to both patients and providers. So after all that, if the measure is shown to be promising, it moves on to implementation, or phase 4. And this is the point at which measures undergo public comment and are approved by CMS for use in a program. Not every measure that's proposed for use in a CMS program ends up making it. CMS takes into account patient feedback, or any feedback received during public comment when making that decision. So this is a great opportunity to make your voice heard about potential measures. If you're familiar with the NQF endorsement process, this is also the phase where measure developers might submit their measures to NQF for endorsement consideration. NQF endorsement is not a requirement for use in CMS programs, but it is viewed favorably as a signifier that the measure meets the desired criteria. And finally, here on the right, there's the measure use, continuing evaluation, and maintenance phase. Our shorthand for this is just to call it measure maintenance. This refers to measures that have been accepted for use in a CMS program. And I hope it comes as no surprise that the work doesn't stop once a measure is implemented. Measures in CMS programs are reviewed and updated on a regular basis, usually annually, to ensure that they continue to align with the most up-to-date information available. So when these changes result in a substantive change, those measures usually need to undergo another public comment period so that stakeholders can weigh in on the proposed changes before they're enacted. Part of this phase is also re-endorsement. So measures that received NQF endorsement must be reevaluated every 3 years to ensure they still meet the criteria for endorsement. And also NQF endorsement and the CMS maintenance piece are really separate processes. They do go hand in hand and align, so it's worth acknowledging them here. So now I'm going to jump into each phase of the measure lifecycle in some more detail, and I'll talk about how stakeholder feedback is used at each phase. So as I alluded to earlier, measure conceptualization is the phase where developers are building the evidence base for the measure concept and the basic elements of the measure, meaning the population to be included, the disease or condition of interest, and relevant interventions or screenings. So this is a fairly in-depth process that includes a number of activities, including information gathering, which typically means something like a literature review. It includes gap analysis, which refers to the process that measure developers use to identify similar or related measures that already exist to identify gaps in the measurement landscape. This is important because CMS doesn't want to invest resources developing measures for conditions that are already really well represented in their portfolio. This is also the phase where developers will make the business case for their measures, so thinking through how the development and implementation of such a measure would impact healthcare costs and quality, as well as the phase where initial stakeholder inputs are collected, and that's via the TEPs, possibly through interviews, and then, of course, also through public comment. So as an individual who wants to get involved in this work, how might that look at this phase? So since this is the beginning of the process, this is typically when developers are putting together their technical expert panels, and in some cases, developers will even put together a dedicated patient and family advisory group, which is basically a technical expert panel made entirely of patients and patient advocates. So this is also one of the points that developers might seek initial public comment on the measure concept. So as a patient, you might be wondering what kinds of feedback you could provide at this phase, and how that information would be used by a measure developer. So conceptualization is a really high impact time to provide insights, especially as a patient. Providing insights about your lived experience with the condition or the treatment or the outcome that's being proposed as a measure can provide really useful context and contours to the measure development team that can inform the measure that's ultimately developed. So as someone who has experience with the healthcare system in a way that the measure developer may not, you are in a crucial position to point out when the measure focus is misaligned with your expectations or your needs. Measure developers are also interested in understanding what you think counts as quality care and understanding how that relates to what can actually be measured. In some cases, measure developers may have a list of potential concepts related to a given condition or treatment that they need to whittle down for development, and your feedback can help prioritize concepts that are of most interest to patient participants. Conceptualization is also a great time for clinicians to provide feedback, which can also be provided via a TEP or through public comment. In particular, clinicians are in a great position to provide context around things like clinical workflows and reporting burden to help inform our understanding of overall feasibility. Also, as I mentioned earlier, measures are often developed based on clinical guidelines, but clinicians can provide input on things like impressions or acceptability of those guidelines that might impact the perceived usefulness of the measure. And as with patients, clinicians may also be tapped to help prioritize measure concepts for further development. So in general, this is the point at which developers are really looking for diverse perspectives from all kinds of stakeholders to make sure that they and CMS are only investing resources to develop measures that are likely to be feasible and useful to those stakeholders. I mentioned earlier that measure specification is the phase at which the potential measure concepts are fleshed out into detailed measure specs. On the left side of the screen, you can see a list of some of the measure attributes that are thought through and described during this phase. It's here that the rough idea of the measure that's formed during conceptualization is broken down into detailed definitions of the measure numerator or focus, the measure denominator, possible exclusions, and the measure rationale and underlying evidence. In the background, measure developers are also working through details such as determining the data source for the measure. So for example, will the measure use information from Medicare claims, or is it going to be based on clinical data from the electronic health record? This is also the point at which developers think through the coding systems that they're going to use to define clinical concepts. So in sum, this is a fairly technical phase that calls upon quite a lot of methodological expertise to do well, but the result of this phase is a detailed measure specification that can be used for testing. And for those who have never seen a quality measure or are new to this concept, here's an overview of what that might look like once the thinking around measure specification has been done. So in its most simplistic form, a quality measure is essentially made up of these things. The numerator, which is essentially the measure focus or the thing you're measuring. The denominator, which is the overall population that's being evaluated by the measure. So for example, in some Medicare measures, the denominator could be all patients 65 years of age and older. And then finally, there are the measure exclusions. So these are patients that should be removed from the measure population before determining whether the numerator criteria are met. There's also such a thing as a numerator exclusion or an exception, and of course there are other attributes I referenced on the previous slide that dictate how the measure is scored and what patients are included in the calculation. But for the purposes of today's discussion, I think this is a good snapshot of a measure's composition. And you can see a visual depiction of that structure here on this slide. So despite how technical this phase can be, there are still areas where patient feedback can be useful. So for example, now that a more fleshed out specification is available to react to, patients can provide feedback about how that measure might positively or negatively impact their interactions with their doctors. Is the measure going to incentivize a provider to use a specific questionnaire or diagnostic tool? And if so, will that improve or worsen the quality of care you receive from those providers? This is also another opportunity to provide specific information about whether the measure is meaningful and important. How might a patient use or interpret a provider's score on a measure like this? Patients can also help think through potential unintended consequences, good or bad, that might be associated with that measure. So for example, might a measure related to shorter wait times for wellness visits result in less time with your doctor once you're in the exam room? And would that be a good or a bad thing? These are all the kinds of things that can help developers refine the measure to optimize it for use in a program. The specification phase is a great time for clinical input. So this is where, for clinicians, that clinical knowledge can really be leveraged to shape and refine the measure prior to testing. So with the increased level of detail available about the measure at this point, clinicians can begin to think through how the measure, as specified, might fit into existing clinical workflows and whether it might create significant feasibility challenges or result in efficiencies or improvements. This is also where clinicians can begin weighing in on the measure's face validity, so thinking through whether a high score on the measure would actually be an indicator of higher quality care. And this is also the time to think critically about the proposed measure exclusions and the risk adjustment model, both of which impact the validity of the measure. And again, clinicians are also positioned nicely to consider potential unintended consequences of the refined measure. So as I said earlier, measure specification flows right into measure testing, which involves both qualitative and quantitative assessments of the measure to demonstrate its readiness for use in a program. This phase is fairly time-consuming. It begins with the development of a test plan, which often lays out testing in two phases, alpha and beta. Alpha testing is preliminary. It largely involves just collecting feedback from patients, clinicians, any other experts, about the measure's feasibility, so that is the extent to which it can reasonably be implemented without creating a lot of burden at practices, and then its usability both to patients and clinicians, and then face validity, which, as I said earlier, is just the extent to which it measures what it's supposed to measure, and then using that information to further refine the specifications before launching into full beta testing. Beta testing involves rigorous quantitative testing using real data to assess whether the measure is able to quantify what it's supposed to quantify and to make sure that the measure can accurately detect differences in performance between clinicians or hospitals. And those results are also used to further refine the specifications and to provide information to CMS about potential pitfalls or challenges that might be associated with implementing that measure. So in addition to participating in TEPs or patient and family boards, the testing phase presents opportunities to participate in things like patient interviews or focus groups. And this is where being a member of a patient advocacy group can be really helpful. So since that's one way that measure developers often seek to identify patients to participate in these activities. And during testing, the feedback measure developers are seeking from patients is similar to what I described under measure specification. So essentially, this is just another opportunity to think through how the measure might impact the care a patient like you would receive, and to talk through whether the measure is useful or important to you relative to other aspects of your care. For clinicians, the feedback you can provide during this phase is a little bit different. So first, if you were to participate as a test site for beta testing, you would get a much more in-depth view of how the measure functions in your clinical environment, allowing you to provide a more informed information about how such a measure might actually be implemented in that setting. But even as a member of a TEP, for example, your clinical background would be instrumental in helping developers interpret findings from site testing, provide insight into the generalizability of the findings. So in other words, just because this measure worked well at the test sites, is it likely that this would work at other practices as well? And if not, why? So your insights could really help the measure team further refine the measure details and to inform their understanding of the potential unintended consequences of that measure. So measure implementation refers to the transparent process by which a measure is submitted for use by CMS and is subject to stakeholder and public review. So as I said earlier, this involves submitting the measure to CMS for consideration, which is done via the pre-rulemaking process. Measures proposed for CMS programs undergo detailed review by external experts to determine their suitability for CMS programs, and then once again undergo public comment to allow stakeholders to weigh in on them. And the most significant way that all stakeholders, patients and clinicians alike, can participate in measure implementation is via that public comment process. So this part of the process is specifically designed to promote transparency and to allow the public to weigh in on the types of measures being proposed for use in CMS programs. You can say whatever you would like to about a proposed measure, but some examples of the types of feedback that can be useful in informing CMS decision-making is either support for a proposed measure that addresses an area an area of interest or concern, or concerns about potential for unintended consequences or harms related to a proposed measure. And finally, there's the measure maintenance phase, which again refers to the processes and data collection used to ensure that measures used in CMS programs continue to be relevant, useful, and sound. So similar to the work done while a measure is under development, measure maintenance requires additional data collection and literature reviews to evaluate the measures according to CMS criteria. Measure stewards must also evaluate the measure's business case to determine whether the measure is performing as expected based on initial predictions. And where deemed necessary, measures may need to be updated or revised. So in other words, this is the ongoing process that ensures that CMS measures continue to meet the criteria required for inclusion in their programs. And as with measure implementation, the best way for clinicians, patients, and other stakeholders to participate in measure maintenance is via the public comment process. So for example, when a measure is being considered for removal from a program, the public has an opportunity to comment on that proposition. This may not be where those of you who are new to quality measurement choose to dip your toe in, but for those of you, especially clinicians, that are directly impacted by the measures in a given program, this can be a crucial way to have your voice heard about the measures that you're accountable for. And now that we've made it through each of the phases of the measure development lifecycle, I just want to reiterate that there are lots of ways, both directly, such as via a TEP or public comment, and indirectly, such as through participation in a patient advocacy group or clinician specialty society, to be involved in the work of developing and maintaining patient-centered quality measures. So at this point, I'm going to turn the discussion to Nicole Brennan, who's going to walk through some of the key resources available to you to help you learn more about quality measurement and to stay on top of the news and announcements related to this work. Nicole?
Thank you, Brenna. So we've learned a lot today about ways to get involved with measure development and how important it is to be part of that community. So just to highlight sort of how you can get into this world or learn more about measure development, I want to point everybody to the MMS website, which you can get to by just Googling the MMS CMS, and it should take you right here to the Measures Management System website. To learn more about getting involved, we have a tab here titled Just That, and if you were to pull that down, you would find a list that mentioned technical expert panels, which we actually have one right now that is recruiting for new members. There's also a place there to look for measures that maybe are open for public comment, as well as ways to link to our newsletters. If you were to go to the CMS Measures Inventory tool, which we call CMIT, here you can find out more about measures that we have within the CMS portfolio. You can sort by any number of filters through the inventory to find measures that you're interested in. So let's say that you are interested in learning about measures related to a specific technical expert panel. You want to get an idea of what measures they might be talking about. You could go here and filter based off of measures, let's say, on depression or other behavioral health. Or if you know that a measure is being proposed to be removed from a program and you want to know a little bit more about the history of that measure, you can find the measure here in the inventory and learn when it was initially proposed for a program, what programs it's currently being utilized in, and when it is scheduled for being retired from the inventory. And just to get more background on any measure or measure set, you can find that here within this tool. As I mentioned, through the website, you can find links to become part of our MMS newsletter community. Through the newsletter, we provide you with updates on what technical expert panels are recruiting for members, new rules that have come out, proposing new measures or finalizing measures. We also let you know about webinars that are coming up over the next couple of months and what their topics will be, and allow you to register for those webinars through the system. And then we also have bulletins, which you can become a member of by just emailing the MMS support at Battelle. And here we do a little bit more real-time updates for you so that you don't miss technical expert panels and other opportunities to engage in this process. Jira is a platform that measure developers use when submitting measures to CMS for the measures under consideration list. If you have an interest in submitting a measure to CMS in the next cycle, you can access the link that we have here, and it'll send you to a quick start guide on how to gain access to Jira and what other resources you might need when submitting a measure to CMS or to a program for them to consider putting into a rule or sending for additional scientific review to be put into one of the rulemaking programs. Additionally, an excellent tool and resource for measure developers is our blueprint. The first two sections really go over what the measure development process is, sort of roles and responsibilities of measure developers, CMS, the measures management system contractor, and then we do a deep dive into each part of the measure development process and how measures can be developed and provide resources to measure developers. Again, if you're just interested in sort of joining a technical expert panel and want to get some background information and measures before you hit your first meeting, the first and second section of the blueprint are great resources for you to take a look at and just get a background information on the process that each measure goes through in order to become part of our healthcare system. The eCQI Resource Center is there for those of you who are specifically interested in electronic clinical quality measures, how to develop them, how to get updates on measure science as it evolves around eCQMs, and also to get the latest news and information related to these types of measures, and also provide you with support as you develop them. The Impact Assessment Report is a great resource for anyone who's interested in seeing how measures are impacting and changing the healthcare system. This report is provided every 3 years, and CMS puts a lot of work and effort into analyzing the measures that are in the inventory and across the entire portfolio, and showing their stakeholders how those measures are being utilized and the impacts that they are currently having. And then to just get a little bit more information on the Meaningful Measure framework that Kim was talking about, we have a website dedicated just to meaningful measures, provides you with additional videos about patients over paperwork, meaningful measures in and of themselves, and allows you to see a lot more detail on what the meaningful measure areas are and answer some frequently asked questions that you might have about this type of framework.
All right, with that, I'd like to thank everyone for their time today, and we will be redoing this presentation in a couple of days. So for those of you who have colleagues that may be interested in joining, please have them register for the upcoming session. Thanks, everyone.